If recently you have noticed that one eyebrow has become significantly higher than the other, or there is a nasolabial fold which appears from one side but not from the other, or my favorite, your jaw is shifted to one side or another, then this video is for you because you have a facial asymmetry. Hi, my name is Anna and I have changed naturally my face from this to this without any cosmetological procedures, just using my hands and some small helpful tools. And I'm here to teach you the same. First, it's important to understand that a certain amount of facial asymmetry is completely normal. In fact, if you are perfectly symmetrical, you're probably a robot. Actually, around 7 years ago, there was a funny app appeared to mirror half of your face, like asymmetrical to the other one, and the people were coming with this type of funny faces. So if you have realized that you have some small asymmetry, don't worry, it's absolutely normal. However, pronounced asymmetry can be a sign of underlying issues. This can generally be categorized in 4 root causes. Number 1 is injuries, the other one is pelvic asymmetry, the third one is bad habits, and the fourth one I'm gonna talk about in the end, and I call it the asymmetry of the 21st century. So let's start with injuries. Trauma to the face, head, or any part of your body can significantly affect facial asymmetry. The obvious ones could be like a broken jaw which was healed incorrectly and causes a permanent shift. Or let's say birth injuries can lead to asymmetry from the young age. However, what you might not know, even an absence of a tooth from one side can cause facial asymmetry, especially if we are talking about nasolabial folds. Or the spine damage, which can influence the whole body movement incorrectly. For example, all the people who have cursed spine or spinal discs injured definitely have facial asymmetry. What can be done about it? Well, obviously, if you have a serious disease or injury all over your body, you definitely know about this and you are probably already consulting with your physician. If not, well, this is your time to do it. Physical therapist or an osteopath who will choose a specific treatment method for you. This will include posture and core alignment exercises on straightening, stretching, and flexibility of the whole body. The second one is our pelvic asymmetry. You might ask me, how does my pelvis connect it with the face asymmetry? They are actually very far from each other. However, our body is an interconnected system. Pelvic asymmetry can lead to compensatory changes throughout the whole body, including the spine, the muscles of the neck, and the face. If one side of your pelvis is higher than the other, then it will definitely cause a chain reaction of imbalances all the way up to your face. To identify the signs of pelvic asymmetry, you need to look at the signs like uneven hips or shoulders, a noticeable difference with the length of the neck, and a tendency to lean from one leg to another. These imbalances often translate to uneven muscle tension in the neck, in the trapezoid, in the back, and the face. Think about this in this way: if the base of the construction is damaged, then the whole roof will shift in one side. So let me show you what exactly we are looking for to identify the pelvis asymmetry. First thing to do is ask someone to take a picture of you, because if you look at yourself in the mirror, you will probably not notice differences we are looking for. So take a picture in the level of your chest. You must stand straight but relaxed, and do not tension the muscles on purpose. Just your normal stand. So what are we going to do next? When you take the pictures, try to draw a straight line. What are we looking for? We need to have the straight line all over the neck, all over the clavicles. So pay attention. If they are shifted or one shoulder is higher than the other, obviously there is a problem with the pelvis, because this is where the asymmetry is coming from. What to do about this? Number 1 is the correction of the posture and working with your lower back. Again, if you have no serious injuries or problems with your health, working with your posture for a couple of months will be enough to level the position of the pelvis, and then together with the pelvis, the face will also get improved automatically. Together with the posture, you also should add some neck exercises, especially if you are sitting in the office and you are probably also having this type of computer neck where the neck is forcing forward. So make sure that you're controlling your face all the time, trying to lift with the crown upwards and drop the shoulders down. And this is how you need to maintain your posture all the time, in every position. If you're sitting, if you're standing, if you're walking. In this case, I also want to add pelvis asymmetry is super typical. well, and unfortunately women are searching for quick results, and men also, and they go to the cosmetologist to make sure that they will put some additional injections in one side and less on the other, so that you would even your symmetry with injections. But this is wrong, because the root cause is not the problem on your face. The root cause is your pelvis, and the more you will inject on one side, the chunkier and the heavier your face will eventually look like. The third one, if you have already observed your body and there is no special injuries, no pelvis asymmetry, you're an absolutely, like a healthy person and your body is quite straight, then you need to pay attention on your everyday habits. They play a huge role in how our face looks like. I will show you several of them. Like this. Habits like chewing on one side of the mouth, sleeping permanently on one side, constantly sitting and leaning your face on one fist, or holding your phone like this all the time, or even if we smile or thrown sometimes to one side. All of this is a bad habit, and this causes facial asymmetry. Example, I always used to think that my right side is much more attractive than my left side. By the way, what do you think? Is it true or not? Well, actually all my life, well, since childhood, I was thinking, okay, this is the photogenic side of my face. I raised my eyebrow up, this one. I also was doing like this with my lips. I'm not proud of it, but it was a habit. And that actually caused a huge disproportion on my face until I already realized it and started controlling myself to get rid of this horrible habit. So what to do with all these problems? Well, first of all, control your face. As soon as you notice that you are doing some bad habit, like you're leaning your face on your fist or any other habit, so remind yourself, okay, stop it. After 10-20 times, I promise that this habit will go away. We can control our body, we can control our face. We just need to remind ourselves from time to time, okay, stop it. Okay, remove the head. Okay, don't put one leg over the other. This also, I don't know if I've mentioned it before, I think I've mentioned, but all these bad habits could also be improved as soon as you just remind yourself, oh, okay, stop it. The second thing to do is to relax your masseters. The masseters are the chewing muscles which are connected here with our face, connects the cheekbone with the jaw, and helps us to chew. Those muscles are very, very strong. They are very tensed, and as soon as you have facial asymmetry, the one masseter gets more tense than the other, and the other is straightening, so it's going something like this. And when you have this type of asymmetry, first of all, you need to relax those masseters. How to do that? I have several exercises in one of my shorts, you can check them out. Another very useful thing is to open your mouth daily for 1-2 minutes. So here how we're going to do that. Slowly, slightly open your mouth. Make sure that you're not shifting the jaw in any direction. Then you put your palms on the masseters. Remember, they are somewhere like this. You can actually also touch them and feel them. They are very strong, tensed muscle. Well, it is normal, but sometimes too much tension is not good. We are looking forward to relaxing them. And you're sitting like this for 1-2 minutes. After that, you need to slowly close your mouth, not to get any uncomfortable feeling. I repeat, this is very important. You should not injure yourself even more or hurt yourself. If you are feeling some discomfort or you don't want to open your mouth even like bigger than, you should probably not do this exercise, and this is a big sign that you have some problems with your jaw. So probably it's time to consult a therapist. And of course, I also recommend that you start facial massages, because this will relax the muscle, tensed muscle, those muscles which are shorter than the other ones, which are shorter than they are supposed to be. This can improve blood circulation and promote muscle relaxation. Do it daily with the self-correction of your habits, and you will see a lot of improvements with no time, I promise. And finally, the fourth reason. I think it could be useless for someone, but other people might find it absolutely shocking. Cosmetological injections is a very typical root cause of facial asymmetry. I'm not talking now about some side effects, because if you have a side effect with Botox, then one eyebrow can easily drop like this and the other can raise. I'm not talking about these severe side effects which can be caused by a way to input the injections. I'm talking about normal flow of cosmetological procedures many women are receiving daily. You can ask me, how can facial beautification be the cause of the asymmetry? Because women are targeting asymmetry with put-in injections, and as a result they what? Get more asymmetry? That doesn't make any sense, but actually it does. When the product is injected, it is supposed to evenly distribute all over your face. The key word here is supposed. In reality, it does not. And any product does not evenly distribute around our body. Some part of the muscle will always get more product than the other, because muscles are not an empty vessel to be filled like a glass of water, right? It's a dense muscular structure or a subcutaneous fat layer, depending on what type of product you're putting where, in the muscle or in the fat tissues, targeting different purposes. And when you put the product in, it is diffused by the tissues, like sucked in. Simple example, when a dentist puts anesthetic in your gum, when the anesthetic stops its effect, it does not disappear immediately, and you unevenly return in your sensation. It's like, oh, okay, now I can feel something here, oh, and now I feel something here, and now I feel something here and here. So it unevenly loses its effect. The same with the injections. When they lose their power, they are not fully disappearing at once. They are slowly, gradually losing its effect. And by the way, I'm not talking about the fillers now, because we all know that the fillers do not dissolve completely. The fillers just migrate, they fall apart, and they are distributing all over our face or our body. If you're putting fillers somewhere else, well, I don't think that you're watching this video. So the injections are slowly losing its power, causing specific parts of the muscles atrophy, which in its turn leads to asymmetry. What to do in this case? It's an interesting question. It's an interesting question. If you go to the cosmetologist, I don't think that they are going to give you the right answer. Otherwise, probably they will advise you to use a more expensive product with higher price, and they will specify that they are more quality ones. However, what I would suggest is definitely to gradually stop doing those chemical intrusions in your face and start trying some more natural approach. Our body has a wonderful capability to restore its tissues, restore injured cells, tone the muscles, cure the disease. Our hands and fingers are much more stronger than any syringe filled with some material or any machine with current heat lifting effect. One comment I'd like to mention that the idea for this video came to me from one of my subscribers. They asked me to do a video about facial asymmetry, and I decided, well, if people really want and they find it interesting, then I'll be able to talk about this. So if you also have some kind of topic on your mind and you would like to know more about it, please comment in the section below and I will do the video on your request. Alright, too much talking today. If you like this video, put likes to me, subscribe to my channel, comment in the sections below, and hit the notification bell not to miss the new video coming. Bye bye.